Hello, good morning all. Today on 2nd April, we celebrate World Autism Awareness Day to raise global awareness, foster acceptance and support the inclusion of autistic individuals in the society. Established by United Nations in 2007, it promotes understanding of autism spectrum disorder, advocates for the rights of autistic people and encourages policies that improve the quality of life, education and employment. The theme of autism spectrum disorder is autism and humanity, that is, every life has value. Autism spectrum disorder is defined as a neurodevelopmental disorder characterized by deficient in social communication and the presence of restricted interaction and repetitive behavior. Epidemiology. World Health Organization estimates international prevalence of autism spectrum disorder at 0.76%. However, this is only account for the approximate 16% of the global child population. It is estimated that approximately 1 in every 100 children worldwide has autism spectrum disorder. Male raised to female ratio is 4:1. Now let's understand etiology of autism spectrum disorder. It has three factors: genetic factor, environmental factor and neurological factor. Genetic factor includes inherited traits and mutation. Environmental factor includes prenatal exposure of toxins, maternal infection. Neurological factors like brain structure deformities and functional differences. Some other potential risk factors: advanced prenatal age, premature birth, family history of psychiatric disorder, maternal obesity, thyroid disorder, prenatal stress event. Thank you.
Myself, Dr. Mohit, about to explain the clinical feature of autism spectrum disorder. Autism spectrum disorder begins as early as the age of 3. The deficits in social interactions is also seen in autism spectrum disorder. Emotional reciprocity or appropriate response to the social interactions are not clearly seen. Non-verbal communications, eye contact, body language, gesturing and facial expressions are also visible in these people. Forming, developing, maintaining relationships are also hard for them. In the further clinical feature, there is restricted and repetitive behavior and or interests. For example, stereotype motor movements, rigid about daily routines or rituals, restricted fixed interests, hyper or hyperreactivity to sensations. Assessment for autism is also important for the diagnosis. The first we will do is the developmental screening, for which we will use MCHECK, which is a checklist for autism disorder in toddlers. Comprehensive diagnostic evaluations is also done. In medical evaluations, hearing test and genetic testing is done. Multidisciplinary team assessment is also done, in which psychologists, psychiatrists and speech therapists are also included. For treatment, we will first go with the behavioral therapies, which is ABA, which stands for Applied Behavioral Analysis. In medications, we will give medications for anxiety and hyperactivity. Then educational support, family support and counseling can also be done. Alternative therapies like music therapy and art therapy can also be done on these patients. Thank you.
Thank you. I am Shruti. Today we are going to discuss about how we celebrate this day. The aim of celebrate this day to focus on acceptance, support and awareness. Acceptance. Autism is a part of who they are. Let's embrace neurodiversity. Support. Early intervention, education and inclusion make a difference. Awareness. Break stereotype and stigma. Autism is not a limitation. This proved by many great and famous people with autism spectrum disorder, like Albert Einstein, scientist and mathematician, Charles Darwin, naturalist and geologist and biologist, Bill Gates, co-founder of Microsoft Corporation, Sir Isaac Newton, mathematician and astronomer and physicist, Nikola Tesla, inventor, Elon Musk, entrepreneur, Lionel Messi, football player, Tom Cruise, filmmaker and actor, Carl Jung, psychiatrist and psychotherapist, Henry Ford, inventor, automobile, Vincent van Gogh, artist, Leonardo da Vinci, artist, Alexander Graham Bell, inventor, telephone. Thank you.
Thank you, Dr. Shruti. So together we can create a world that's inclusive and supportive for everyone on the spectrum of autisms. With the theme of this day is autism and humanity. Every life has value. Thank you all.
Thank you, sir.
Okay.